Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, custom machine kept man alive without lungs for 48 hours. The patient, a 33-year-old man, had severe lung infections that turned his lungs into a liquid substance, requiring the removal of both his lungs. Removing both lungs creates a major physiological problem, as the heart has nowhere to pump blood to without the lungs. To keep the patient alive, the medical team engineered a custom flow adaptive extracorporeal total artificial lung system, TAL, that temporarily replaced the patient's entire pulmonary system. The TAL device used a specialized pump, oxygenator, and other components to maintain the patient's circulation and gas exchange for 48 hours until donor lungs became available for a successful transplant. Analysis of the removed lungs showed they were beyond repair, helping define the point of no return for severe acute respiratory distress syndrome, ARDS, where transplant becomes the only option. This case represents a breakthrough in keeping patients alive without lungs, offering hope for those previously considered beyond saving by transplant teams. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. /speak